Welcome friends. We are revising homeopathic remedy Medorrhinum, and this happens to be the part 2B, clinical or applied materia medica. And we have taken up the text from Allen's Kenote, and from academic point of view this remedy is and this part is very good for BHMS students, interns and house physicians. I am Dr. V.K. Chauhan. Let us go ahead to the constitutional prescribing aspect of Medorrhinum. The number one condition we will find children who are pale, rachitic, dwarfish, and stunted in their growth. They are mentally dull and weak. They have difficult concentration. And patients who cannot speak without weeping. Patients who are afraid of darkness and they are in fear of getting insanity. Patients who have despair of recovery from their illnesses and who become worse from thinking about their problems, their complaints, their diseases. Patients who suffer from diseases from the daylight to sunset, morning to evening, that is a psychotic modality, and syphilitic modality is opposite symptom you will find in syphilinum. Patient is worse, sunset to sunrise, who are better on lying on their knee chest position, better at seaside, better in wet weather, better from lying on abdomen. Let us go to the specific indication of this remedy. We have fiery red rash especially developing in babies who are few days old around the anus. The baby when they pass urine, it scalds them terribly. And then comes the cholera infantum with opisthotonus, vomiting and diarrhea of extremely weak and emaciated children. Foul smelling stool passed involuntarily, ichorous discharges from the rectum. And then we have an acute bowel trouble. And here we have to remember that especially it is indicated in children who have rickets. There is a Mongolism of children, Down syndrome, trisomy 21, with history of gonorrhea in parents, with characteristic symptoms of Medorrhinum. We will find offensive body odors of psychotic children. They have marasmus, especially in infants. Let us go to the seventh condition, ailments of female. We have females, their breasts and nipples are very sensitive and sore to touch. Breasts are cold as ice, especially the nipples, while the rest of the body is warm. Please remember, it is especially true during menses. Ailments from gonorrhea, suppressed gonorrhea, or inherited gonorrhea. It includes gonorrheal rheumatism, neuralgia, and sciatica. Infantile marasmus, enuresis, tendency for masturbation. There is a precocious sexual development in such psychotic children. They are backward, having ovarian tumors, selphingitis, abortion, especially in females, peritonitis, orchitis, condyloma, and warts. Gleat, associated with impotency and sterility. Epithelioma of wing of nose, lips, nasal polyps, and asthma with skin diseases. You will find ninth condition ailments with the following concomitant symptoms. They include number one, burning of hands and feet, wants them not only uncovered but they need to be fanned. Enlargement of the lymph glands. It is not a active enlargement or inflammatory enlargement. Spinal curvature or pronounced traces of rickets you will find in your patients. There is insatiety or you can say craving for liquor which they used to hate. Albuminuria with some of the pus cells can be there, can pass a stool, especially by leaning far back. Intense restlessness and fidgety of legs and feet. So, 10th condition is sciatica, left sided, pain worse, early morning, better at seaside. We have asthma, which is better lying on niches position, better at seaside and during wet weather. Renal colic with sensation of passing calculi. So, friends, thank you. Thank you very much for your patient listening and watching. Please remember that sharing is caring.